Good afternoon, everyone, and thank you for joining us. My name is Amy O'Halloran, and I'm a MyMedicare Program Officer within the Practice Support team. I do have my two colleagues joining us, Kayla and Carol, and they will be monitoring the Q&A function on the screen, and they will be on the panel at the end to answer any questions you may have. Before we begin, I would like to acknowledge the traditional custodians of the land on which we meet today. We pay my respects to elders past, present and emerging, and I extend that respect to any Aboriginal and Torres Strait Islander people joining us today. Just a few housekeeping tips. Please note that this webinar will be recorded and will be available on our CESPN YouTube channel within the next couple of days. At the end of the webinar, the evaluation survey will pop up in your web browser, and we do appreciate your feedback. Please complete this to allow us to issue certificates of attendance. And please ensure that you submit your questions in the Q&A function throughout the presentation. To view this box, hover over the toolbar at the bottom of the screen. There will be plenty of time at the end of the presentation also to answer your questions. I just wanted to let you know that there are a few upcoming events. There is one on Thursday, the 14th of August, which is today, My Medicare Urgent Care Clinics information session. Thursday, the 21st of August, Depression in Primary Care, and Thursday, the 9th of October, as Cybersecurity for Your Practice. We do regularly run CPR workshops. They are held monthly to make sure that you're up to date with those. I also just wanted to remind you that the Primary Health Nominations Awards are open and they will be closing on the 31st of August 2025. We encourage you to nominate and share this information with your colleagues. Okay. We do just want to again highlight that we are here to support you and your practices from our practice support team, our digital health team, and also our aged care team. At the end of this webinar, I will have the email addresses directly to all of the teams that we can support you in. I did want to highlight that we do have, this is a 3-part series of lunch and learns. Today's one, which is the overview of MyMedicare and GPACI. We do have our webinar 2, which will be run by my colleague Carol, and that will be specifically for GP and residential aged care homes and the collaboration. That's held on Wednesday, the 27th of August. I will send the links through for these registrations as well. And then we do have our webinar 3 run by Kayla, and that will be a big focus on tracking the payments and the visits. I would like to introduce Kayla just to say hello now.
Hi everybody, my name is Kayla and I'm the MyMedicare Support Officer from the Digital Health team here at CESPN. Amy's going to do an amazing job of explaining the GPACI program today, and Carol and I will go into further detail in our presentations. However, the best way to learn more about meeting eligibility requirements for your individual patients is by booking in a one-on-one appointment with someone in the team. So I'm really happy to come out to your practice and help you work out what services need to be completed for each patient. I can also confirm that your patients have been registered correctly, and patients who are no longer receiving GPACI services from you are removed from your list. So please feel free to reach out at any time. My email address will be in the presentation slides.
Great, thank you, Kayla. All right, so the overview of today is really to touch on what is MyMedicare and how does the General Practice and Aged Care Incentive work together. We will be addressing the benefits to the patients, the benefits to the practice, patient and GP eligibility, and then the GP registration and servicing requirements. And then there'll be a list of resources for you, and then we will have time to go through any questions that you may have. So hopefully we all know by now what MyMedicare is, but just to touch on it briefly, the whole purpose of it is to strengthen the ties between patient and their usual GP, encourage that continuity of care. It allows the GP to understand their patient populations and supports the shift from episodic care to longitudinal, preventative, multidisciplinary based models of care. And GPACI, so we know it stands for General Practice in Aged Care Incentive. And the purpose of this is to enhance access to regular GP visits and care planning for the aged care residents, to strengthen the relationship between the residents and the primary care providers, and to reduce the avoidable hospitalizations and improve that continuity of care. The benefits, so this ties back with MyMedicare and GPACI, is that, as mentioned, the continuity of care, the access to the services, and then for the practice, the access to these incentives and improved patient management. And in the whole, it is so we can support, and you can support the residents and families and the carers. The greater access to their primary care, that regularity of having that GP coming in to see them, to provide that formal establishment of the relationship between patient GP practice and then the supporting staff. So the patient eligibility, and again, I'm tying everything back to GPACI, the patients must have a Medicare card or a Department of Veterans Affairs card. They must permanently live in the residential aged care homes and be registered to the MyMedicare program and linked to an eligible practice and responsible provider. You will see on the screen that I have put in just a link of the MyMedicare registration form. We do know that patients can register on My Health and also the MyMedicare Express app. However, I am aware that the patient population that you will most be seeing, they may not have access to this, and the form may be the best bet for them to be able to fill in and register. Also taking into account that perhaps the population, they may not be able to sign on their behalf, that there may be the next of kin who may need to sign this. We are getting feedback that some GPs are taking this out to when they visit an aged care home, leaving it there till they come back again, and then hopefully in that time it will have been signed. Also, some of our GPs have said that working closely with the residential aged care staff to help them facilitate this, and also if they have a new resident coming into their home, that this is in the welcome pack as well, just to make that transition smoother. The GP eligibility, so we know the GP must belong to an eligible practice registered in the MyMedicare program, be registered in MyMedicare before they can start registering their own patients, be registered in the General Practice in Aged Care Incentive Program, and be declared as a responsible provider of eligible services to the registered patient, including the coordinating services provided by the whole care team. The registration process. So practices and providers must register via PROTA and H+, and patients must also be registered. The responsible provider must be linked to the patient's MyMedicare profile, and the incentive period must be set in H+. I know this can be quite confusing. I do have the link that we will send in the email post this with the detailed steps of how to go about this. But as Kayla mentioned before, we are more than happy to come out to you to make sure that you're going through the registration process, to registering patients, to ensure that it's all set up going forward. And then we can also do a recheck-in with you to see how you're going. Just a little bit more on the registration process. So to register as an organisation, to set up your organisation site, register for the MyMedicare program, and then to ensure that you will receive these payments is to make sure that the banking details are correct. So going on to the servicing requirements, I know this is a little convoluted, but essentially the responsible GP and practices are required to meet the servicing requirements to be eligible for the incentive payments, including the delivery. So we need to have the 2 eligible care planning services over the 12-month period and 2 eligible regular visits per quarter, each in a separate calendar month, delivering at least 8 regular services over a 12-month period. So as you can see the image there, so it's the 2 eligible care planning services and the 2 eligible regular visits per quarter. So it essentially is the 10 over the 12-month period. I have put on a timeline here, and I know there's lots of talk between the financial year and the calendar year and the quarters. So I'm just going to offer a few examples. And again, we can come back to this at the end if needed. So for this first example, we'll say patient A registered on July 17th in GPACI. That means that their quarter 1 would be July till September. Their quarter 2, October to December. Their quarter 3 is January to March, and their quarter 4 is April to June. Say if you had patient B register in November, their quarter 1 would then be October to December. their quarter 2 would be January to March, their quarter 3, April to June, and their quarter 4, July to September. I'll just offer one more example. If there was a patient who registered, say, the 20th of April, their quarter 1 is April to June, their quarter 2 is July to September, their quarter 3, October to December, and their quarter 4 is January to March. The quarters will roll on, however, the month calendar breakdown stays the same. We also have had some feedback about the timing of when the patient registers, and I know there's that 48-hour window, but potentially if you can say, if you had a patient register December 31st, it would be in your best interest and the patient's best interest to hold off to then start that registration in January. So then the quarter 1 would be January to March. If you did register on that December 31st, you're almost losing that 3-month period to be able to meet the requirements going forward. Okay, so the incentive payments. So the payments are the $300 per patient per year paid to the responsible GP, and $130 per patient per year paid to the practice. There are some rural loadings with the MM3 to the MM7, but we won't touch on those right now. They will be talked about in our webinar 3 a little bit further on. So this image is a nice summary. Again, it's just showing that there's $300 per patient per annum paid to the responsible provider and $130 per patient per annum paid to the practice. So it's for delivering the 10 eligible services comprising of the 8 regular visits, the 2 per quarter, plus the 2 care planning items. There has been a toolkit developed by the department. Yes, it is in Excel, and yes, it can be quite onerous and administrative burden heavy. However, it can be a good tool to either use as an example or as a way of tracking your patients. So you can document, monitor and track which quarter and 12-month service requirements have been delivered. You can use it to identify any patient needs and service gaps. And then you can plan the care and predict the activity of the responsible providers or the alternate care team also. I will send the link through this as well, so you can have that and you can save it on your desktop, or it can be a part of the workflow that you do at the beginning of the day. So essentially, it's about bringing it all together. So the resident, the practice, and the provider need to be registered for MyMedicare to access this incentive. The resident registers for MyMedicare. As we said, they can be done MyMedicare online or via the app, but in this instance, most likely it will be through the paper form. The practice registers patients for the incentive, and then the GPs and their care team begin delivering the eligible services. Now, essentially, we are doing these webinars to make sure that we are offering the best support for you so you guys can maximize the incentive. We will be doing, as I mentioned, further educational webinars and lunch and learn. So we really do appreciate and value your feedback about those and see how we can tailor them specifically to the needs of you guys. We are constantly updating the resource hub on our website with the most accurate information that we receive that then we can share with you. And going back to what Kayla said at the beginning of the presentation, the goal is to offer you direct assistance with everything from registering through to patient tracking to monitoring your quarters. We would like to come out and meet with you to make sure that it's all set up the way it should be, and again that you are maximizing the incentive. We will, if you'd like that, we would make our email addresses will be in the end of the presentation, and we can make that direct contact with you and set up those times to come out to see you. We can also do some follow-up ones, say in the 3 months, to ensure that those are being met and you have full understanding of how the incentive is working and in your benefit. As mentioned, here is my email address, my phone number, and then we've got Kayla's email address and Carol. We are here to help. That's our role. And so if we can, that's what we would like to do. Here is a list of resources. I know there's so many out there, but these are the most accurate and up-to-date list. When I share the slides post-presentation, I'll make sure that these links are clickable and they can send you directly to the sites. These are also on our website, and we'll be making sure that as we get new information come in, that we keep these updated and then share with you. More contact details. So we do have the practice support, we do have the digital health, and then we do have the aged care team all across this program and this incentive to offer the support for you. I know I have talked way too much. I would like to welcome back Kayla and Carol and have a look at the Q&A box. We will be going through and answering the questions to the best of our ability, and we will see what questions we have, and I'll open it up, Kayla and Carol.
I don't think we have any questions in the
No
Q&A.
questions. I'm sure there's some burning questions out there. Does anyone have a question that they would like to ask, or I can go back through the slides, or
Well, I can think of maybe some frequently asked questions and things that we might be able to chat through just in case it jogs an idea for somebody about some questions that they could ask. So one question that I've been hearing a lot from practices is, what do we do if we don't know which quarter our patient's registered in? Because obviously if you have a lot of different patients that might have started receiving care at different times, it can be hard to keep track of which patients are in quarter 1, quarter 2, quarter 3. So you can do that using HPOS. There's something called the forecasting eligibility tool, and that's something that I'm definitely happy to go through and show you in person. I'll also be talking about it in my webinar in September, but you can look on PRODA and it will tell you which patients are in which quarter.
Okay, great. Thank you, Kayla.
I have a question for you guys as well. Does it need to be the same doctor that visits the patients for all regular visits? What happens if a doctor goes on unplanned or unexpected leave, or they're retired? What happens in that situation?
So one of the regular visits each quarter needs to be done by the responsible provider, but the other one can be done by somebody different as long as they're registered at the same practice with MyMedicare. So that might be another GP, a prescribed medical practitioner, a nurse practitioner, a practice nurse, or an Aboriginal and Torres Strait Islander health practitioner. So as long as the GP is doing the care planning items and the responsible GP is also doing at least one of the regular visits per quarter, then the other one can be done by somebody else at that same practice.
Yeah. Thanks, Kayla.
I just wanted to highlight that it's really important to keep an eye on your HPOS notifications, just to make sure that you might be receiving messaging within that, and who it's going to. Is it the practice manager, the receptionist, or is it the GP? Just to keep an eye across those notifications as well.
And I can see we've got a question in the chat. Can you go through acceptable care plans? So I'll send through a resource after the presentation with the slides that has a list of all of the different item numbers there, just to make it a bit easier. But some of the care plans that you might be able to do for those care planning items are a contribution or review of a multidisciplinary care plan, a comprehensive medical assessment, a case conference, or a residential medication management review. So there's different item numbers that can be billed for those depending on the length and the type of practitioner and things like that. So we'll send that out, but those are the main care planning items that you can use.
Great, thank you, Kayla. Are there any other questions from any of those? I know it's your lunchtime and your precious time for joining today, so we do appreciate that. But if you do have questions, please pop them in. And as I said, we can offer that direct assistance to you. As you'll see, our email addresses will be in there, so please reach out to us via email or by phone, and we can set up those appointment times to come out to see you. Kayla and Carol, do we have any other questions that we thought might pop up?
Yep, we've got one just come through on the Q&A box. So do I have to be accredited?
So to register for MyMedicare, you do have to be registered for accreditation. Once you register for accreditation, you have 12 months to become accredited to continue with the MyMedicare program. However, there is an exemption that's in place currently, and that is for GPs who are in a non-traditional practice. So if you're a GP who is mobile and you're only visiting aged care residents, then please contact the practice support team and they can support you with starting to sign up for MyMedicare or GPACI because there is an exemption in place for those types of practices.
Thanks, Kayla.
Thank you, Kayla.
I've got a question as well. Is there a minimum or maximum number of residential aged care home residents I can enroll in the GPACI incentive program?
No, there's not. So even if you just have one patient, that's fine. You can still enroll them in the program.
Okay, perfect. Thank you.
So we've had a question come through. Do I have to provide a care plan within the first quarter? We highly recommend that you do provide that first care plan within that. So it's the 2 care planning plus the 8 servicing requirements. So the care planning, it would be best practice to do that within that first quarter. Any other burning questions from anyone out there, or any feedback, or how we can support you? Well, it must have been a very clear presentation. If we don't have any questions further, I'll just give it a minute or two more and see if anything comes through. But as I mentioned, there will be, we will send this post. We will have an evaluation feedback that you guys can fill out. That'll really help us, as I mentioned, tailor any questions or any specific webinars going forward. We've just had a question about over servicing. Now we've had this quite a lot as well. Essentially no. The guidelines are, if there's the 10 over the 12 months, there's the over servicing, you can't really be over servicing, and it's just ensuring that continuity of care for those residents.
Just got another question come through. Do we need to wait for at least 3 months to do the second care plan?
I think given that there are so many different MBS item numbers that can be billed with those care plans, we'd have to look in the exact combination of them for you and send through some of the MBS online information so that you can have a look through and see how frequently you're able to bill those different care planning items. Because even though they're all called care planning items, some of them might be, for example, a residential medication management review. So those things don't always have to be billed 3 times apart from other care planning items, but it would be good to check on an individual basis to make sure that you're meeting the requirements.
Thank you. And another question we've got is, how do we register patients for the incentive?
I think that's a really great question that I will go through in a bit more detail in my webinar in September. But first they have to be registered for MyMedicare. So as Amy said in the presentation, that might be about getting them to sign the consent form. And then there is an extra step that you need to do to register them for the GPACI program. So in HPOS, in your list of MyMedicare patients, there's an option where you can add the GPACI indicator to the patient. And by doing that, you'll also have to add a start date and you'll have to link them to the responsible provider. And so that's an extra little step that you need to do for your GPACI patients that you don't need to do for patients who might be visiting you in your regular practice who you want to register for MyMedicare. So we can also send through out with the meeting notes an example of how you might do that, but I'll definitely go through it in a bit more detail.
Thank you, Kayla.
I can see we have another question. Item 697, how many reviews are patients allowed in any 2 years?
So again, I think with specific item numbers, we'll have to look into that for you and give you that advice from MBS online.
Thank you. Yeah, we will get back to you. We will also be including all the questions following the presentation as well. So you'll be able to review the questions and the answers to those as well. We've had one question about what happens with a deceased patient.
So if a patient passes away in that 12-month period, because the payments are paid quarterly, you will still get the quarterly payments for the times if you met the requirements for eligibility when the patient was alive. So for example, if they passed in Q3 and you had visited them for 2 regular visits in separate calendar months in Q1 and Q2, you would have already gotten those payments for those quarters. And then if you get to the quarter where unfortunately they have just passed away, then you will not receive a payment for that quarter if you haven't met the eligibility requirements. But it's really important as well that you stay on top of putting an end to the GPACI indicator on HPOS if your patient does pass away. So that way you won't continue to get notifications saying that you aren't meeting eligibility requirements when that's not possible for you anymore. So that's something that I can also show you how to do. You can add an end date onto that patient, and then the GPACI program will have ended at the date they passed away.
Great, thank you, Kayla. Just going back to the 967, so I know that can be quite confusing with the CCM changes, but the 967 will not be used in residential aged care homes. It will be the 731s. We will put that into a more detailed answer as well.
I've just got one more question. Has the MBS item numbers for the care plans changed?
So the MBS item numbers for the GP CCMPs, the care plans that happen in your clinic, have changed as of July 1st, but the care planning items for residential aged care home patients have not changed. So that's still 731 for the multidisciplinary care plan.
Thanks, Kayla.
Thank you, Carol. Okay. Any last burning questions before we let you go back to enjoying some lunch and back to it? I can't see any, so I guess I would just like to say thank you for all attending, and as I mentioned, appreciative of your time. And if you do have any questions, if you need that direct one-on-one assistance, please do reach out, and we will be more than happy to come out and see you all. All right, well, I will let you all get back to it. I thank you all.